Welcome to Thoughtful Thursdays. Today we are lucky to have with us Dr. Sajida, and she is a fertility consultant. Thank you very much for joining us, Dr. Sajida.
It's a pleasure to bring me here today, Dr. Tariq.
Wonderful. This is such an interesting subject, and I think many people don't know much about it. So I hope that you can benefit us with your knowledge and your expertise. Can you just generally give us an idea of what it is that you do?
So we usually treat couples basically, when they are not getting pregnant after marriage, being together and trying for 1 year. So we treat the couples basically trying to help them to have their children, when they wanted to.
And is it very accessible? Like, is it easy to go to a fertility doctor?
It's very easy to go to the fertility doctor. When the couple think about, they wanted to have a baby, they are trying so hard, or they have seen their gynecologist, they have done the basic fertility workup, and if there is any finding or anything, they can book an appointment. Even basically their gynecologists are referring as well if they deemed necessary for them to send it to the fertility specialist.
Do you think there's a little bit of a taboo around the subject? Like, would people be comfortable to be seen walking into a fertility
It's much
place?
improved. When I joined here in this country 14 years ago, it was a big taboo at that time, but with the social media approach, and giving the information about the fertility, it is less likely considered as a taboo in this population. So mostly their males are also willing to come over and do the investigation. So that's a lot of improvement since the time have passed. And education, obviously, social media have played a big role in that. Basically, what we can say about roughly that the chances of infertility coming from the female is around 60 to 65%. And the rest is the male factor as well. And in 10 to 20% of population, there's a combination of the factors, that coming from the female and the male. So we have to do full investigations and evaluation of the factor, that what is the reason for them. And sometimes there may be no reason. It is completely unexplained. And in that way, we can counsel the couple that, look, we don't have any reasons for you're not having a baby. It may be a time. It may be sometimes, the more complex factors, maybe genetic and something. That we can find it out when the people go for further treatment like IVF or something like that in the future.
Yeah, I see. So there is a little bit of a majority of the situations, the issue is coming from the female side. What can you do in such situations? Can you change that? Can you change the fertility of that lady?
We can help in some cases, like if there is a problem with the ovulation, like PCOS. 20 to 25% population in the Middle East, they suffer from the polycystic ovaries. Girls, young girls, this is kind of an endocrinological syndrome that suffer women, So we can help them by having an ovulation, simple ovulation inductions medication. We can do the folliculogram to see their follicles and egg size and stuff. This is way we can simply help the woman with the polycystic ovaries. We can give them natural advice like reduction of the weight, having a healthy diet, taking folic acid to reduce the chances for having a miscarriages later on as well. So simple piece of advice sometimes help the couple to have the children. But if there is more complex scenarios like endometriosis, and if the stage of the endometriosis, if they affect the ovaries and the tubes, if there's a tubal block and stuff, so there's more further advanced treatment is available in the form of IVF and ICSI treatment that we will do in our unit.
You mentioned weight. Is there a statistic that says that infertility has increased now that obesity has become more of a problem in society?
Yes. Certainly, because weight has a big implication. It affects your ovulation in the female especially, and in the male also, if high BMI affect the quality of the sperms. So from both ways, weight has a very big implication. Not only those, but also increasing the chances of the miscarriage with a high BMI woman, and increasing the obstetrical complications later on when she get pregnant. There is a high risk for the miscarriage and anomalies in the baby, and plus there is obstetric complications of having a more chances for diabetes, high blood pressure, early preterm labor, and difficult to deliver the baby.
So is this something you discuss with the patient when they come?
We do. we do discuss with them. This will be the first initial advice we give them at the first consultation. If they both have a high BMI, we wanted to reduce the BMI, take a healthy diet, exercise, and being living in healthy will improve their chances for pregnancy by themselves without having any treatment.
Okay, and is there any relation not between the quantity of food? Of course, when we eat too much, we will gain too much weight, right? But is there a certain food which is good for your fertility? Does such a thing exist?
There's kind of only myths, we can say, is a healthy eating, that what we can advise. Basically, some women, if eating the burger, they can get pregnant, but there is some genetic predisposition for these women, if they are eating like a more fatty diet and stuff that increases their body mass index, they reduce their chances. There is a lot of things, in this culture as well. Some women are coming with a herbal teas, like, they called as a maramia or something like that. There's no proven evidence for that scientifically.
Yeah. What can we do as a society to increase the general fertility of the population, or is there nothing specific we can do? Is it all coming down to our individual
As a general
efforts?
piece of advice, Dr. Tariq, I would say that increasing the awareness that when they should contact the fertility specialist, this is very, very important. We cannot leave. Obviously, there is something that is missing still in this population, that women are left alone sometime to struggle by the gynecologist. They don't check their egg reserves. If the egg reserves is find it out very early, they don't need to wait for 1 year to come to the fertility specialist. It's the same way. If the male does not have the sperms, basically, they does not wait, to try 1 year and to get pregnant. From where they will get pregnant, So they need an early referral to the fertility specialist if there is a definitive reason for the infertility is there.
Is that more a message to the doctors or more a message to the patients?
General
or to
population
both?
as well,
Yeah.
to both. They are aware that where they have to go for the help and stuff. And if there is a problem with their periods, if they feel that something is not right, they should come and see, to do a simple blood test that can tell them about their egg reserves and stuff. It's a simple, outpatient screening test that they should do it before, that is too late to come to the fertility specialist. And even they can come over into the clinics, for themselves, for the checkups and having a screening done, every yearly. That is a good, advice that I would suggest for the younger population, because there is an increase in male factor plus female related to the egg reserve issues in recent years.
That's a very valuable point, and as is everything that you have shared with us. It has been very educational, Dr. Sajida. Thank you so much for making some time to share your expertise and your knowledge with us, and I'm really grateful for that.
Thank you very much. It's a pleasure to be in here today.
Thank you.